Hi, Chris, nice to meet you.
Hi, nice to meet you.
So, thanks for coming in today. Do you mind if I ask you some questions about your substance use?
Sure.
Okay. So initially when you were filling out paperwork, I know that you came in today because of some stomach discomfort and some trouble sleeping. But in filling out your questionnaire before you came in, you filled out one of our screening tools, which is the audit, which screens for alcohol use. And you scored in a moderate risk scale.
Really?
Yeah. You seem surprised by that.
Yeah, I feel surprised by that. I mean, you said moderate to low?
Yeah, moderate to low risk. Your score was about a 17. When we see that score come up, normally we like to have a conversation with people about their drinking, because sometimes that could play a factor into kind of what they're here for in the first place. So, do you mind telling me how much and how often you drink?
Sure. Can I ask a question first?
Yeah, absolutely.
Moderate to low risk for what?
A whole host of health concerns. One that may be particularly relevant to you is gastrointestinal related stuff, kidney, liver disease, anything in that realm may be potentially linked to drinking, even if it's not, what we call abusive drinking. Even drinking to, a certain extent could be. Yeah.
Okay, I'm sorry, you said sure. How much do I drink?
How often are you drinking?
I mean, lately I've been having trouble sleeping because of my stomach.
Okay.
And then, sometimes I just want to, I want to go to sleep, I can't, so I just have a few drinks.
Okay, how many is a few?
I don't know, at most, like on a bad night, it can be up to like 5.
5?
Yeah, 5 beers.
And how many nights a week?
That's not all the time. Mostly I have like between 2 and 3 every night, maybe 4.
Okay.
Yeah.
So between 2 to 3, some nights as many as 5.
Yeah, it really changes a lot, but I always have a little, something to relax me.
Okay, and 7 nights a week?
Yeah.
Okay. And mostly beer, you said? Mm-hmm. Okay. Like 12-ounce beer or?
Yeah, regular, yeah.
Gotcha. So, do you mind if I share some information with you?
Sure.
So, according to the NIAA, the National Institute for Alcohol Abuse and Addiction, the recommended or the low risk drinking number for women is no more than 3 on any one given day and no more than 7 on any one given week. So it sounds like even on the low end, if you're having 2 a day, 7 days a week, you're more than twice the low risk numbers. So that could be putting you at that moderate risk category.
I didn't realize. I mean, I know people that drink so much more than me, and they're functioning.
Sure. Yeah. So it's, drinking at those numbers doesn't necessarily equate to addiction or alcohol abuse or anything like that. But it does put you at that high risk for developing other health problems, which may be related to what's bringing you in here today.
I didn't think about it. It makes sense though, because I've been like really acidy and just like the pain in my stomach is so bad.
Sure. So those things could be potentially connected, which is why we ask these questions. Have you ever thought about trying to reduce or cut down your drinking?
I mean, to be honest, not really. I mean, I never thought it was an issue,
Okay.
So yeah, I mean, you've given me something to think about, I guess.
So would you consider maybe, considering it now?
Yeah.
Sure.
Yeah, I mean, if it really is related to my health issues, then yeah, I mean.
It very well could be, and that's why we wanted to have this conversation, just to kind of rule anything out. A lot of times it's something that gets overlooked in terms of being related to our health, and would it be possible for you to consider, staying within those limits of less than 3 drinks a day and less than 7 in a week? Do you think that's a reasonable goal?
Yeah, it might take me a couple of weeks to get used to it. Not that I need it, but just the pain's still there, and I want to be able to sleep, and I work. It's just kind of a vicious cycle. So it's
sure.
I don't know how to even start, actually.
And that's something that we can definitely talk to your doctor today about, maybe getting something to help with some of the pain, the stomach discomfort, and maybe helping with the sleep, and that way you don't have to rely as much on the alcohol to do that. It sounds like there might be a little bit of self-medication, if you will, with the alcohol. Sure, yeah, which is normal, and for a lot of folks, that's kind of the, what precipitates that increase in drinking. So if you you know, to kind of assess where you're at with it, if you had to pick a number between 0 and 10, 0 being not ready at all, 10 being absolutely ready, how ready do you think you would be to kind of reduce your drinking at this point?
I don't know, maybe like a 4, only because I'm genuinely surprised. At, you know, I didn't think I'd be adjusting that, but I'm willing. I mean, like I said, I don't want to suffer. So if that's what it is, then I'm willing to change. Sure,
4 is great. Why a 4 and not like a 3 or a 2 or something like that? Why such a high number?
Well, I don't know. I mean, I was embarrassed at first, and it kind of made me feel like I didn't need to be. Like, it happens a lot. So
yeah. No, it's definitely a very common thing. A lot of people aren't familiar with those high risk or low risk numbers. A lot of people aren't, you know, educated on the fact that the connection between substance use, you know, even especially alcohol use, can have so many impacts on our overall health. So yeah, no need to be embarrassed.
Thanks. Yeah,
I totally
that
understand.
word substance. It's like
yeah, it's scary, right? Yeah. It's scary. Okay, so you're about a 4. What are the pros? What are the things that you like about drinking?
I mean, I have to be honest, I don't love it or anything. It kind of relaxes me when I can't sleep. You know, I use it for a purpose, I think, more than anything.
Sure.
You know.
Any negative things that come along with it?
Well, I mean, my stomach obviously is affected by that.
Yeah.
I don't feel great in the morning either, actually.
Okay,
Yeah.
so you're not feeling that great in the morning?
Yeah, but I mean, I've never been a morning person, so.
Sure, yeah, me neither.
Yeah, it's terrible, but yeah, I think it's not great for me, yeah.
Sure, okay. So just to kind of recap here, not really a lot of benefits from drinking, you're saying? You kind of use it for a purpose. It's kind of just to put you to sleep at night when you're having trouble sleeping or if you're having some stomach pain.
I don't even think about it, but yeah.
Yeah. It's great that you're becoming aware of it. It's great that you have such a good awareness around how and why you're using it. That's a huge...
Well, thanks. Yeah, I didn't think I did, but yeah.
So not really getting a lot out of it. There are some things that you don't like about it in terms of, you know, it's just hard to wake up in the morning, kind of groggy, you don't really find a lot of pleasure in it. You're about a 4 on the, you are ready to make some change. You're about a 4, you'd put yourself at about a 4 for wanting to change. You're thinking that you could get within those low risk numbers. It might take some time.
Yeah, just to adjust. It's kind of become a routine.
Sure.
You know.
Yeah, changing that cycle. Absolutely. You would like to follow up with your doctor about maybe some healthier alternatives to dealing with the stomach discomfort and maybe some of that, it sounds like acid reflux, and maybe something to help for sleep at night, because those are the things that are kind of making the drinking a little bit more prevalent.
Yeah, thank you. And I really appreciate that, because that's what's unbearable, is not being able to sleep.
Sure.
You know, so I appreciate it.
Is there anything else I missed?
I don't think so.
Yeah. All right. Great. Well, thanks so much for your time. I'll go get the doctor and I'll talk to you soon.
Thanks.
You're welcome.
Nice to meet you.
Nice to meet you as well.